Now we need to talk about body sculpting. What the one thing when people come in for a consultation is, well, I want my stomach gone. What I always tell people, are you trying to lose weight or are you trying to contour and shape your body? Because there is a difference. Body contouring, such as Coolsculpting, such as liposuction, such as Emsculpt, are not necessarily meant for weight loss. They are meant to contour a certain area. Coolsculpting freezes the fat cells. So it was going to remove about 20% of the fat cells that you have in the area that you're concerned about. How it does it is that it freezes it to a point where the cells die. Those cells get processed out through your liver and you have more bowel movement. So those fat molecules, they don't come back. But I always tell people, if you gain weight, it is going to go somewhere. These body contouring procedures are not meant for weight loss. You may lose some weight during the process, but that's not the goal of them. Liposuction, the same thing. This is a little bit more removal of fat. So if you have a little bit more than just a small pocket of fat to remove, then I'll usually tell people that you may want to consider liposuction because you can actually remove more fat at one time. Liposuction can be done in the office. It can be done in an outpatient surgical center. Depending on your practice and your physician, that will determine how they actually do it. We do ours in office, but I always tell patients I don't remove more than a certain amount of fat under local anesthesia with liposuction. Emsculpt. What is Emsculpt? Emsculpt is a device that actually builds and tones muscle. So you could do your arms, you could do your abdomen, you can lift the butt muscles with Emsculpt. You can do your calf muscles. So it is meant to build muscle. What I tell people with Emsculpt is that when you do one session of Emsculpt, it's equivalent, if you're doing abs, it's going to be equivalent to 20,000 sit-ups. If you're doing your butt lift, that's equivalent to doing 20,000 squats in one session. So it is meant to build on the muscle. It will reduce some fat as well. Once again, if you have more fat than muscles, then you may want to consider either Coolsculpting or liposuction. But the other thing that Emsculpt does is that for people who have, so you've had pregnancies or twins, and the muscles are usually that form your 6 or 8 pack kind of splay open a little bit. So when you sit up, you feel this bulge. That's called a diastasis. It helps actually correct the diastasis. It helps build your core muscles. So for some people who have very weak core muscles, it will help build that. So those are body contouring procedures. And once again, I always tell people they're not necessarily meant for weight loss. Weight loss is different. But the other thing with the weight loss is that it should be a lifestyle change. So I don't know if anyone has questions. If you do, this is the time to ask me.
There were no questions, but
Okay.
Chloe said, "Hi, Dr. Terry."
Hi, Chloe. Thank you for joining us. We actually do have, they just gave this, some specials. So this month, we are doing, because we knew that everyone is on their new journey with the beginning of the year. So we are doing $100 off the first month for weight loss if you do a 3-month enrollment. And then we are also doing buy 3 Coolsculpting cycles and you get 1 free, plus you get 20% off the Emsculpt. So those are some of the specials that we have so that we can help you start this journey and continue on for the remainder of the year. We all do it where we're like, okay, I'm going to be a new person this year, but this year, this is the year to actually really do it. Now, just for some housekeeping, we are celebrating our 10th anniversary March 14th. So we're planning to have lots of new and innovative services that we're going to be offering this year. We're really focusing on wellness. Stem cells is going to be one of those. Ketamine will be one of those for mental health and chronic pain. We're looking at some other devices to help with mental health. So this year we are really trying to treat the whole person. And that's from mind, body, spirit, the whole you. So that is what we are focusing on this year. And we'll have every month we'll have more and more information that we'll share with you regarding the anniversary. Because it's a big year. So it's our 10 years. So we've been doing this for a while and we want to continue to grow. We want to make sure we are bringing you more new and exciting and innovative, at least the information, so you know what's available to you. So thank you again. Sorry, that's my phone. Thank you again for joining us on our Talk with Terry Tuesday. We do it every month, the third Tuesday of the month. So we will see you next time. Oh, sorry, the second Tuesday of every month. And so if there are things you want to talk about, things you want to address, send us the information, but come and see us so that you can actually learn about all of the things that we have to offer.
Oh, Dr. Terry, there was a question.
Okay.
It was on Facebook. Would you have a list of the items that we should be eating or drinking with the weight loss medications?
So the big things are going to be limiting your carbs and increasing your protein intake. Because I don't tell anyone that you can't have something. You just have to know what's in it and how much of it you can actually eat. So there are different apps. There's MyFitnessPal, there's Carb Manager. Those tools will help you. You can type in whatever the food is, and it'll tell you what a serving is, how much protein, how much fat, how much carb is in that serving. We just have to become much more familiar with what we are eating, because I will tell you, when people come in for these weight loss journeys, they are shocked to see what's in the food they're eating and how much carbs there are. A bowl of cereal, for example, is 1 cup, and nobody does 1 cup of cereal, but it's one serving and it's usually around 40 to 50 grams of carb. So if I'm suggesting to you to have only 100 to 150 carbs a day, well, you just ate a third of your carbs. So you have to, and that's if you have just 1 cup. So we have to look at what we're eating. The processed foods are always going to be higher in carbs, sugar, and salt. So make sure whatever it is that you're eating, when you're going to the grocery store, start looking at the labels. Know what a serving is. If it has fiber, you subtract fiber from the carb intake, and that gives you what your total carbs is. Your body doesn't retain fiber. So it is, I don't like to limit people to what they can eat. Vegetables are something we should be eating. Even if you do the frozen vegetables, do that. Your meats are your protein. So beans, fish, chicken, not fried chicken, because there's breading. You could saute your chicken in olive oil. That's a healthier way if you want a little bit of a crisp. But those things will help you. Your protein intake you have to do. So like I said, the beans, the fish, the eggs, all of those things are protein. Carbs are going to be probably mostly everything else, and everything has carbs. So I'm not going to limit you, but just know what's in the food that you're eating.